Hi friends, myself Dr. Maddineni Srinivas. So in this video and MCQ, you'll understand what is the importance of reading the question carefully from top to bottom without missing out the important clues which the examiner wants to give you. So the question says, man is pierced with thorn in one of his fingers. It becomes inflamed and swollen. So the clue, most important clue is thorn prick was there. And with minimal pressure applied, greenish sweet smelling pus freely oozes from the lesion. Considering the clinical picture, which of the following is the most likely etiological agent? And by looking at the thorn prick, most of the students have wrongly marked as Sporothrix Schenckii, option C. But please also observe this color, which is green colored pus, and the two sweet smelling pus which is oozing out from this lesion. So if you have read this, you will remember that Pseudomonas aeruginosa, which is going to produce Pyocyanin and Pyoverdin, which are pigments which will be of green color. That is the answer in this case. Okay, so most of students answered wrongly. After I have given a clue that it is green colored pus, then the few students have marked it as option D, Pseudomonas. This is from a telegram group, crack Derma with DrMSD. You can join, the links are in the description. So Sporothrix Schenckii, I have explained it very detailed fashion in this video. I will leave the link for that in the iCard and also in the description. You can check that out and watch that. But in this video, we are going to see Pseudomonas aeruginosa and its manifestation. So you can see puncture wounds can frequently become infected with Pseudomonas species, and the patients are going to present with sweet fruit smelling discharge which will be of green color, So let us use the pen also in green color. So remember friends, whenever you get a green color in the infection, then you should think about Pseudomonas. As you can see here, this is intertrigo. Between two web spaces, you are able to see some maceration which is having this green hue, and again you can see this is paronychia, which is chronic paronychia. You can clearly see the inflammation of the lateral nail folds and also the proximal nail fold, and you can observe the green colored nail plate. The explanation for this part of nail, that is green nails, I have given in this video. You can check that out. I will leave it in the description also. And these are the risk factors for Pseudomonas infection. And I hope this video was helpful. Please do hit that like button friends if this was helpful, so that it will motivate me to make more of these videos. And very good, one student answered this right. And yesterday's question, the pilonidal cells is the answer for that question, which is a part of follicular occlusion tetrad. And this is tomorrow's MCQ. Pause this video and try to guess what is the answer. You can follow me on Instagram and Telegram. So thank you so much for watching this video till this point. Myself Dr. Maddineni Srinivas. Happy learning. Sarvam Sri Krishna from Sarvejana Sukhino Bhavantu.